So let me show you some what we call a bread and butter pathology. This is a common routine case, something that we see every day, and it's one of the most common cases in the medicine in general, and it's probably the first case the medical students are going to learn about. And this is the acute appendicitis. Okay, so it's still it's a disease, okay, with an acute onset. Okay, we know how to diagnose it, we know the etiology, that the etiology could be either bacterial or viral. In case of bacterial, the cause is usually a fecalate that will plug into the appendix and will obstruct it. Okay, so the edema and the bacterial overgrowth and the subsequent inflammation, septic inflammation, will cause an acute appendicitis, and this is the most common one. Occasionally, the proliferation of the lymphoid tissue around the appendix can also cause symptomatic acute appendicitis, which is usually viral in nature. So let me first show you the normal mucosa of the appendix. Let's zoom out. So we have the mucosa inside, and it's surrounded by this very dense prolific lymphoid tissue. Then we have the submucosa, where we have the vessels, the lymphatics, and things like that. And then we have the muscularis propria on this side, and the appendix outside is covered by a serosa. So as you can see, the mucosa of the appendix is a normal colonic mucosa, and it consists of crypts which have a similar size and shape, and we have also this very dense lymphoid aggregate surrounding the mucosa. So now let me show you the acute appendicitis. Now if you keep this picture in your head, okay, let me show you what the acute appendicitis looks like. So this is an area of acute inflammation. As you can see now, the mucosa has been completely obliterated, and the infiltrate here, I don't know if you guys are going to see that. Let's see, how about now? Okay, all these cells here, this is a purulent basically inflammation, and as you can see, all these are neutrophils, and they extend from the mucosa. They have destroyed the mucosa, extended through the muscularis propria, and goes all the way out in the periappendiceal fat, okay, which is we call a periappendicitis, and it's a symptom of acute peritonitis. So this is most likely a ruptured acute appendicitis. This is the one which we also designate as a complicated appendicitis. They require a more extensive surgery, but after the removal of the appendix and a course of antibiotics, the mortality rate should be very low.